My parents always wanted to make a difference in the community. And whether it was through their involvement in nonprofit organizations, whether it was through my dad's business, they wanted to make an impact that they could see while they were living. So as their capacity to give to different projects in the community grew, nursing became very obvious to them as a place to recognize, because nurses often aren't recognized.
I am Natasha Schauer. I am a team facilitator in the ICU and a nurse. So I'm the charge nurse on the night shift. So managing patients, managing families, managing staff, it's all intertwined.
We have so many challenges in these days. Our patients have become sicker and sicker. It takes more knowledge and more devotions and more accountability to taking care of our sickest of sick patients.
I have a couple of aunts that were in the nursing profession, and I looked up to them, and I thought, okay, well, I should probably give this a try. And I started off on a telemetry unit and then got into the ICU and loved it from the moment I stepped in there. And then I would get the call when I came in for my shift, and they'd be like, well, do you want to float to the ICU? They need help. I'm like, absolutely, I'll be there. It's not the same from one day to the next. And any given shift you walk in, it's a totally different shift. We could be full capacity at like 21 patients, or we could have 10 patients, but they're the sickest 10 patients that you would ever come across.
When our patient becomes very sick, they go on devices and they are on the multiple drips, they are on the ventilator. So all those patients need our skill set to take care of these patients. And she owns that accountability to improve her knowledge base, attending conferences, and studying on her own times to acquire the knowledge that's necessary to take care of these patients.
I've always been big on continuing education, but I have two girls and they're teenagers now, but I always wanted to be that person that wanted to show my kids, be an example. And they would sit at the kitchen table and do homework, and I'm like, I should be there with them. Like, I felt like I needed to do that. I don't know why, it's just probably a crazy thought in my head. But I would sit at the kitchen table with them, and they would be doing their homework, and I would just be studying. I'm like, I'll just do whatever, like I'll do a course or whatever, and I'll just be with them. And I wanted to show them too, like, just because I have an established career doesn't mean that I can't stop learning. As an adult, we all can learn. And I wanted to show them that. I wanted them to know that when you get older, don't stop. It's great. Learning is great. And I think it just makes us better people.
Thinking about her continuing educations, more than 200 continuing education a year, attending all these several conferences, and providing care to all these sickest of sick patients.
I'm not going to know everything. I know that. But I do feel like I owe it to my patients to know and to try and keep learning. Because if I can't recognize when something is going bad, then I'm failing them. And I can't live with that. I can't do that.
It is a privilege to be able to honor my parents, Bob and Carol Bush, and to continue their legacy of recognizing excellence in nursing care in our community. Nursing is a calling. Natasha has a level of care, concern, compassion for people, and she expresses this through her nursing, and she is involved with the most critically ill people, and she has a gift. I don't know how else to express it.
I always feel like we owe it to our patients to be the best that we can be, because they come into the hospital very sickest, and they come in very sick, and then they trust. They don't know me, but they have to trust that I am going to do what's best for them to help them to get home, because that's the ultimate goal. I owe them that. I just need to do that for them because they're trusting me to do this. And this is not just a job. For me, it's not just a job. This is me helping, because that's what nursing is all about, is helping those people that can't help themselves and when they're very vulnerable. And I feel like that's what I owe them.